Hello, I'm Dr. Ramzi Extractor. I'm the inventor of the Ramzi Extractor. If you bought it already, this video is going to help you a lot by showing you how I use it, my approach, teeth root separations. Of course, I never extract any tooth without separating the roots. You're going to see how easy it is. The video at the end is not edited, is not cut. You're going to see the whole procedure, how I remove two totally damaged teeth. Only the roots were there in less than 6 minutes. And this is the instrument. This is the Ramzi Extractor. Okay, in the video, the extractions were done with the previous prototype that had a different handle. We have improved the handle since, but the head is the same. This is the head, working head of the Ramzi Extractor that you're going to see in the video. I'll let you enjoy what's coming next. Preparing the field. Before using the Ramzi Extractor, I take advantage of the waiting time after administering anesthesia to properly prepare the field. For single-rooted teeth, I file the interproximal sides of the tooth to be extracted, creating enough space for the movement when forces are applied. For multi-rooted teeth, I always start by reviewing the X-ray to assess the root anatomy. If the molar has clearly distinct roots, I reduce the crown height, almost completely removing it. This gives me excellent visibility, allowing me to separate the roots from the start before introducing the extractor. If the roots appear grouped into a single conical mass, I treat it like a single-rooted tooth and simply file the interproximal sides. So I'm gonna show you the full session of extraction. It's not edited. I didn't cut any sequence. So you can see the whole procedure, the time it takes. Anesthesia was done already, of course. We have a lower last left molar, number 37. And I have the upper left side as well, the premolar, which is totally broken at the root level. I'm going to remove both teeth. See how I put pressure without moving to loosen the ligament. I'm using only the Ramzi Extractor. I elevated the soft tissue away from the teeth first. I don't use any other instrument. It's designed also to reflect the gum. Notice how I lock the head of the Ramzi Extractor and I just put pressure without moving. I'm finding a lock, of course. Once I use the lock, I put constant pressure and then I elevate, and the tooth is out. So 3 steps. Find the lock with the small grooves that are on the head of the Ramzi Extractor. Once it locks on the root, put constant pressure, don't move, give time for the ligament to become loose, and then you start elevating. Now we're moving to the upper second premolar, and we're going to do the same. Using only the Ramzi Extractor. So now I'm searching for a lock with the concavities of the instrument. They will lock on the convexity of any root. This is why this instrument is designed to remove any tooth, as long as we're separating the roots. I'm reflecting the gum here. I don't use any other instrument to reflect the gum away from the root. And that's the beauty of the instrument. As long as we're removing roots, all the teeth become the same. I don't need any other instrument. No other elevators. Of course, no more forceps. I was using the suction often in this video to keep the field clear. So that's why you're going to see me using the suction. Now I'm looking for the lock. My Ramzi extractor is inserted. In general, if you put a constant pressure within 90 seconds, the ligament, an inflammation is created, the ligament becomes loose, and the root starts getting ready for being elevated. I move from the mesial and then to the distal. I apply the same principle. First step, lock. Second step, don't move, just put constant pressure. I can try to go deeper. When I feel a slight movement of the root, I know that my root is out. It's just a matter of time. The ligaments are loose and the tooth is going to come out. I'm sure about it. Pressure, see how I put pressure? I wait, I don't do anything. It's funny because the patient sometimes is wondering, like, what is he doing? Is he really removing my tooth? No more head shaking. And when I finish the procedure, sometimes also they make the remark, like, doctor, I didn't feel anything. You should be patient. Do not be impatient. And it's very difficult to change our habits. Okay, waiting for 1 minute, doing nothing, just putting pressure, is a little bit new, but it changes the whole approach for dental extractions, teeth extractions. See now how my tooth is out, no effort. That's the head of the Ramzi extractor. The handle has changed since, and we improved its design.